Band 3 team. We're completely non-clinical. We work 7 days a week. We start at 8 and finish at 6, so we join the ward rounds at 8 o'clock. So on AMU we've got 40% of patients that are discharged directly from the unit, which obviously creates a lot of paperwork. And we looked into the discharge process, and we realised that the HMR was a very timely document, and also because it was being done quickly, the quality could be improved as well. So our team was implemented to tackle both those problems. We found that patients were waiting up to 7 hours from a decision that they could be discharged to actually leaving hospital, and one of those elements was because the HMR was being left because the doctor had gone to see a amusing patient, they'd gone to do another clinical errand, and it had just been left and not been completed. So our team is there to start off the HMR, and we also use Brown history notes, which were previously completely unused. And we use those to add more comorbidities onto the document, which improves finance, because the more comorbidities you have on HMR, the more codes you get, the more money you get. As simple as that. So even if we just do the comorbidities, there's still an added value there, and then the HMR is ready for the doctor to sign, put the TTOs on, and they can just update any other tests that the patient has, so we can fill out as much as we can. If they're awaiting a result, we can just put awaiting or an ellipsis, and the doctor can put negative, positive, or they need further treatment. We advertise externally, and we've had some really interesting candidates. I myself are a textiles graduate, completely non-clinical, and we've had people from the police, HCAs, war clerk. We've just employed a young girl that's just done a psychology degree, mothers, so quite a new pool of recruitment that we've never fished in before, so it's very exciting. And from my own personal perspective, I really do feel like I've been employed for how I think, not my experience. NHS experience comes from working in the NHS. Can you multitask? Can you run to deadlines? Can you work in a stressful environment? How have you demonstrated that? And a lot of these skills can be achieved in other areas that are quite easily transferred. We looked at our reduced length of stay, and we found a 4-hour difference, and so that saved 4 hours sitting in bed waiting for a document to be done. So obviously that's a huge benefit to the patient. And then the impact on our staff is that one of the main things we found was the difference between an AMU admission and an AMU initial assessment was halved, so from 2 hours to 1. So the doctor wasn't behind, sat finishing a letter because he wanted to finish with this patient first because he was already around the emergency department clerking another patient, and that was 1 whole hour, which was half, so that was quite impressive. There's also more sort of job satisfaction on the unit as well. There's more, because people don't complain when they're focused to their core role. If you're a doctor, you want to be doing clinical jobs. You don't want to be sitting for 3 hours writing letters. I don't mind working on weekends at all because you get the time back. So we do 10-hour shifts on a 37.5-hour contracts. So that works out at about 4 shifts. So you're going to get a day back in the week anyway, even if you have the weekend off. And I just find it flexible. You can't car in the garage, dentist appointments, whatever. You don't have to worry about it because next week you've got Wednesday off, week after that Thursday, Friday, and I actually enjoy having more time back. I've previously done 9 till 5. I've done 40 hours and I'm working 5 days, whereas here I work the same amount but less days, and there's huge benefits in that.